Hay fever, aka allergic rhinitis. Now, the hay fever season has already begun for some. Symptoms can include coughing, sneezing, itchy eyes, watery eyes, itchy throat, itchy ears. Now, the severity is very different for many people. Some may have very mild symptoms, where others will have very severe symptoms. Severe symptoms can be awfully debilitating. It can mean time off work. It can mean that you can't care for your children as well as you want to. So, I've devised some top tips to get you through the hay fever season. There are lots of things that we can do to reduce your symptoms of hay fever. Avoiding walking through parks, not sitting on grass. The pollen count is particularly high early morning and early evening, so avoiding being out in these times is ideal, but I know that may be difficult if you need to get to work. Applying some Vaseline on the inside of your nose or in the nostrils will help try and block some of the pollen getting into the airways, provoking the reaction that causes the symptoms. Vacuuming regularly will remove pollen from your house, as well as dusting with a damp cloth over surfaces. When you've been out all day, or after work, or after working out, or just being in the park, even though I said avoid being in the park, come home, shower, wash your hair. This will remove all of the pollen, or most of the pollen, again reducing your symptoms. Once you've done all those things and you're still having symptoms, the next thing to think about is medication. Over-the-counter medication is your first go-to. We recommend using antihistamines first line. Now, these may include Loratadine, Promethazine, Chlorphenamine, Cetirizine. It's important to note that some of these may have some drowsy effects, which you may actually want, particularly if you're having symptoms at night and it's stopping you from sleeping. But always check the label, particularly if you need to operate heavy machinery or need to drive. Now, there are other types of medication that we can get over the counter. Nasal sprays, for example. They can really improve some of the symptoms, such as sneezing and runny nose. Applying nasal sprays. Now, I see people do this wrong all the time. People are very inclined to sniff into the nasal spray, but that simply doesn't work. The idea is that you have to gently inhale. So you place the nozzle into the nostril and breathe gently. And we always recommend alternating between left and right so that you can get a good even distribution of the medicine inside the nostril. Now, most nasal sprays contain steroid. Steroid is not ideal to be used over 6 weeks as it contains steroid, and long-term steroid use can affect the nasal mucosa, so the lining of the nose, which can cause some dryness and itchiness and at times bleeding. So if you do use a nasal spray, make sure that you limit it to just 6 weeks. Eye drops can help with sore and itchy eyes. There aren't really any side effects with these, but continue to use these regularly through the hay fever season. Once you've done all those things and your symptoms are still not quite there, it would be time to see the GP. We can prescribe much stronger antihistamines such as Fexofenadine. These are non-sedating and they work really well, as long as you start early. The trick with all antihistamines is that you've got to try well before the season starts, so that you get a really good long-lasting effect. Many people will say antihistamines don't work, but you must get in there early. Finally, steroid injections. Unfortunately, these are not offered on the NHS. However, you can get these privately, and they can cost between £80 to £90. Now, the steroid injection is normally given in the bottom, and it will last about 6 weeks. However, as I've already mentioned, the hay fever season is starting earlier and earlier and lasting longer. So it may be that you require another injection to get you through the season. Most private clinics are now offering a reduced rate if you require a second injection after the 6 weeks. It's important to mention that the steroid injection is quite a large dose of steroid, and it may be associated with some side effects which include insomnia, tummy pain or headache. I would advise consulting with your doctor before going ahead with this injection, just to ensure that you're well enough to have this medication and that you're not on any other medications that may interact with this. I hope you enjoyed. Please stay tuned. You can find me on Instagram, Twitter and Facebook.